Hello everyone, welcome back. Hope you all are studying well. So today we will be discussing about neonatal hypoglycemia. So let's start. Abnormal low level of blood glucose level less than 45 mg per deciliter. Normal level of glucose in first day is 45 to 60 milligram per deciliter. And 50 to 90 milligram per deciliter in older than 1 day. So what is hypoglycemia for neonatal? That is low level of blood glucose less than 45 milligram per deciliter. At 1 day, normal level of glucose is 45 to 60 milligram per deciliter. And after 1 day, it is 50 to 90 milligram per deciliter. Now, what are the causes? Low birth weight baby and baby of diabetic mother. Starting feeding late. Stressful condition like hypothermia, sepsis, asphyxia and respiratory distress which increase glucose use. Depleted glycogen store. So these all are the causes. Let's revise it. Low birth weight baby, baby of a diabetic mother. Starting feeding late. In case मान लो कुछ cesarean section या कुछ मदर का complication आया है, in such cases क्या होता है? Feeding late में start होता है. And stressful condition like hypothermia, sepsis, asphyxia, respiratory distress which increases glucose use. If baby is compensated with this all situation, then also that glucose will be used in those stressful condition. Then depleted glycogen store. Whatever glycogen it was stored in the baby, it will be depleted. So all these are the causes. Now, clinical manifestations in severe hypoglycemia. Increase respiratory and heart rate, then sweating, restlessness and hypothermia, tremors and jitteriness or shakiness or seizure. Apnea with cyanosis may be present in preterm babies. Now, management. Start breastfeeding within half an hour of delivery and as soon as possible in warm environment. Symptomatic infant with convulsion, administer 2 ml per kg of 10% dextrose IV as a bolus. We know that in vaginal delivery we have to start breastfeeding within half an hour, and for cesarean section it is within 4 hours. So we have to start as early as possible. And symptomatic infant with convulsion, those infants having convulsion, we have to start administering 2 ml per kg of 10% dextrose IV as a bolus. Symptomatic infant without convulsion, what we have to do? Administer 2 ml per kg of 10% dextrose IV bolus over 1 minute. After giving bolus dose, give infusion of dextrose at a rate of 7 mg per kg per minute. If hypoglycemia continues, administer medication like diazoxide, a drug used to lower BP in acute hypertensive emergencies and to treat hypoglycemia due to hyperinsulinism. So, ये सब देने के बाद भी अगर मान लो 2 ml पर kg ऑफ 10% डेक्सट्रोज देने के बाद भी अगर हाइपोग्लाइसीमिया है तो हाइपोग्लाइसीमिया continues, then we have to administer medicine like diazoxide, right, which is used to lower BP in acute hypertensive emergencies and to treat hypoglycemia due to hyperinsulinism, or octreotide to decrease insulin secretion. These two medicine we can use. Okay, so next topic is tetanus neonatorum, that is 8th day disease. This is called 8th day disease. So infection of umbilical stump or navel after birth by Clostridium tetani. Infection of umbilical stump or navel after birth by Clostridium tetani. So what is the microorganism? That is Clostridium tetani. Causes क्या है? Clostridium tetani, it produces a neurotoxin, that is tetanospasmin, which cause tetanus. So Clostridium tetani, it is producing neurotoxin that is called tetanospasmin, which causes tetanus. Then source of infection are soil, horse, cow dung and instrument used during labor. So if it is not aseptic technique, then also this infection can spread out. And non-sterile technique, see, it is also written same thing in the ligating the umbilical cord. First, we are not using aseptic instrument. Second, we are not using sterile technique. So here we are using non-sterile technique. That's why there was a chance to spread this tetanus. Now, what all are the clinical manifestation? First symptoms appear after 7 days of birth and refusal to feed and apathy. Common initial symptom. Keeping mouth open, locked jaw or trismus. Tonic spasm of muscle of jaw, example like masseters. Due to disturbance in trigeminal nerve, that is 5th cranial nerve, jaw unable to open. Did you understand? So let's see the next point. Rhiza sardonicus, a peculiar grin as seen in tetanus, caused by acute facial spasm, raised lips due to facial muscle spasm. So exposed teeth look like stupid smile. Did you understand? So here what is happening? See, Rhiza sardonicus, a peculiar grin as seen in tetanus, caused by acute facial spasm, and where what is happening? Raised lips due to facial muscle spasm. So exposed teeth look like stupid smile. Then opisthotonus, that is body become like a opisthotonous position, that we are studying now, that thing. Now management. Active immunization of pregnant woman with 2 TT injection. Administer human tetanus antitoxin antibody against Clostridium tetani, that is 500 unit. Keep the room well ventilated, peaceful and dim lighted because of photophobia. Stop oral feeding and start IV fluids. Start nasogastric tube feeding 3 to 4 days after starting treatment. So basically tetanus is not coming immediately after birth. It is coming after 7 days of birth. That's why it is called 8th day disease. Did you understand that basic concept? And we have to manage, like we have to give immunization to the mother when she was pregnant. Okay, with 2 TT injection. Then we have to administer human tetanus antitoxin antibody against Clostridium tetani, that is also 500 unit, and we have to keep the room well ventilated, peaceful and dim lighted because the baby can have photophobia. And no oral feeding should be continued. Then we have to start IV fluids. Then starting nasogastric tube feeding 3 to 4 days after starting the treatment. So hope it is clear to all of you. Now coming to next, that is ophthalmia neonatorum. So let's see. Inflammation of conjunctiva during first 3 weeks of life. So inflammation of conjunctiva during first 3 weeks of life. Mode of infection क्या है? Infection of birth canal at the time of delivery. Infected hands of caregivers. And causes क्या है? Neisseria gonorrhoeae. Symptoms develop within 48 hours of age. It is rare but very serious. Then chlamydia trachomatis. Symptoms develop after 5 days and it is very common. So Neisseria gonorrhoeae, it is developing within 48 hours of age, but it is rare condition but very serious. And chlamydia trachomatis, it is coming late after 5 days, but it is very common. Then other agents are streptococcus, staphylococcus, herpes simplex, etc. What all are the clinical manifestation? Watery mucopurulent discharge from the eyes, then sticky or swollen eyes. Then what will be the management now? We have to give eye care to the newborn by sterile swabs moist with normal saline, inner canthus to outer canthus, same as adult. We are doing in adult now also that inner canthus to outer canthus. So every individual we are doing the same thing. Then we have to administer soframycin eye drop, administer prophylactic erythromycin ophthalmic ointment. Then Craig's method क्या है? Use of 1% silver nitrate solution instilled into newborn's eye immediately after birth for the prevention of ophthalmia neonatorum, that is gonorrheal ophthalmia. So these all are the management. We are giving eye care to the newborn by sterile swabs moist with the normal saline, inner canthus to outer canthus. Then what we are doing? We are administering soframycin eye drop. And for prophylactic, we are giving erythromycin ophthalmic ointment. And what is the Craig's method? We are using 1% silver nitrate solution instilled into the newborn's eye immediately after birth for the prevention of ophthalmia neonatorum, that is for gonorrheal ophthalmia. So hope all these are clear to all of you. Now next topic is respiratory distress syndrome. It is a serious lung disorder of newborn due to immaturity of lungs and inability to produce surfactant. What all are the clinical manifestation? Features of respiratory distress like tachypnea, nasal flaring, expiratory grunting, rib retraction, seesaw respiration, then hypoxia, pallor and cyanosis. Then acidosis and hypothermia. All these are clinical manifestation. So let's see again. Features of respiratory distress like tachypnea, nasal flaring, expiratory grunting, rib retraction, seesaw respiration, then hypoxia, pallor, then cyanosis, acidosis and hypothermia. Now come to management part. Administer surfactant replacement therapy through endotracheal tube. And we have to monitor ABG. We should take sample from umbilical artery and oxygen saturation level. So these two, hope you have understood. Then next is administer oxygen at lowest possible concentration to avoid retinal damage that may cause retinopathy or prematurity. So these all are the management. Now fetal alcohol syndrome. What is that? So let's see. Birth defects, that is teratogenesis in an infant born to a mother who consumed alcohol during gestation. So a pregnant mother who have consumed alcohol, in that cases birth defect or teratogenesis can happen to the newborn baby. Now clinical manifestation, small head with multiple facial abnormalities. Example क्या है? Small eyes with short slits, then low nasal bridge, then short palpebral fissure, hypoplastic philtrum, then short and upturned nose, thin upper lip, etc. Then abnormal palmar crease. It is present in that baby. So abnormal palmar crease also present to the baby. Then congenital heart disorder, respiratory distress, tremors, poor feeding and seizures. Then management part, advise the mother to avoid alcohol consumption and smoking during pregnancy. Then position newborn on side to drain secretion. Monitor for respiratory distress and hypoglycemia. Then coming to torch syndrome. So what is torch syndrome? See, infection of fetus or newborn by T for toxoplasmosis. Okay. So see, T for toxoplasmosis, disease caused by protozoan infection. O for other viruses like such as syphilis, Treponema pallidum, crosses to placenta throughout the pregnancy and infect. Okay. So O for क्या है? Other viruses such as syphilis, Treponema pallidum, cross to placenta throughout pregnancy and infect the fetus, usually after 18 weeks of gestation. Due to this, preterm birth, stillbirth and low birth weight occurs. Now R for rubella, causes congenital heart disease, cataract and growth retardation. Then cytomegalovirus causes microcephaly, blindness, deafness and mental retardation. H for herpes simplex virus, it causes neurological impairment or death. टॉर्च में क्या है? Infection can attack a growing embryo or fetus and causes abortion. Abnormal fetal development, severe congenital anomalies, mental retardation and fetal or neonatal death. So all this can happen in this torch syndrome. So let's revise it again. Infection of fetus or newborn by T for toxoplasmosis, that is disease caused by protozoan infection. O for other viruses such as syphilis, Treponema pallidum, cross to placenta throughout pregnancy and infect the fetus, usually after 18 weeks of gestation. Due to this, preterm birth, stillbirth and low birth weight occurs. R for rubella, causes congenital heart disease, cataract and growth retardation. C for cytomegalovirus, causes microcephaly, blindness, deafness and mental retardation. And H for herpes simplex, causes neurological impairment or death. Torch infection can attack a growing embryo or fetus and cause abortion. Abnormal fetal development, severe congenital anomalies, mental retardation and fetal or neonatal death. Neonatal hypothermia, low body temperature in newborn below 36.5 degrees centigrade or 97.7 degree Fahrenheit. Normal temperature of newborn is 36.5 to 37.5 degrees centigrade. It is a leading cause of death, especially in premature baby. Classification क्या है? Normal temperature 36.5 degrees centigrade to 37.5 degrees centigrade. Mild hypothermia, when we will call it mild hypothermia or cold stress. This is very important because they won't tell you mild hypothermia. They will ask for cold stress. That is 36 to 36.4 degrees centigrade. And in Fahrenheit it is 96.8 to 97.6 degree Fahrenheit. Moderate hypothermia, that is 32 to 35.9 degrees centigrade. That is 89.6 to 96.6 degree Fahrenheit. And severe hypothermia, that is less than 32 degrees centigrade and less than 89.6 degree Fahrenheit. Now what are the causes? Large body surface area per unit of body weight, decreased amount of subcutaneous fat and brown adipose tissue. Brown fat is the site of heat production. Okay, immature or thin skin, excessive heat loss by evaporation from wet baby, conduction to cold cloth, convection by cold room or cold air, separation of baby from the mother. So all these are causes for hypothermia. Hypothermia का causes है क्या है? Large body surface area per unit of body weight, then decreased amount of subcutaneous fat and brown adipose tissue, because brown fat is the site for heat production. Okay, then immature or thin skin, excessive heat loss by evaporation from wet baby, conduction to cold cloth, convection by cold room or cold air, then separation of baby from mother. Now coming to clinical manifestation, that is metabolic acidosis, respiratory distress, hypoglycemia and apnea. Then site of temperature in newborn. Axillary, it is commonest method because it is safer as well as accurate. Keep thermometer 3 minutes inside the axilla. Rectal, it is used for only sick hypothermic neonate. To take core body temperature, insert 3 cm in term and 2 cm in preterm for 2 minutes. So you have to remember that because we are inserting 3 cm in term baby and 2 cm in preterm baby and keeping it for 2 minutes. Clear? Now management. In moderate hypothermia, maintain skin to skin close contact with the mother. In severe hypothermia, rewarm the newborn by keeping into incubator, that is 36.5 to 37.5 degrees centigrade temperature and 50% humidity. We are keeping baby in incubator. Now room heater, 200 watt bulb or infrared bulb can also be used. So room heater, 200 watt bulb or infrared bulb can also be used. Maintain warm chain strictly to prevent hypothermia. Warm chain is set of 10 interlinked procedure carried out at birth and later, like warm delivery room, immediately skin to skin contact with mother, that is kangaroo care, etc. Now what is kangaroo mother care, KMC? Right? It is a special way of caring for low birth weight baby, that is weight below 2000 gram. Hypothermic babies also. Okay? And it benefits by effective thermal control, breastfeeding, infection prevention and bonding. All these will be achieved. Okay? Now KMC satisfies all 5 senses of infant. Baby should be placed between the mother's breast in upright position. Skin to skin contact, exclusive breastfeeding and early discharge and follow-up care are 3 major components of KMC. KMC can be started as soon as baby is stable. Babies with severe illness or requiring special treatment should be managed according to the unit protocol. The length of skin to skin contacts should be gradually increased up to 24 hours of day, interrupted only for changing diapers. Clear? Now minimum duration of 6 to 8 hours should be practiced. It should not be less than 1 hour. So we are increasing the length of skin to skin contact up to 24 hours a day, interacting only for changing the diapers. Minimum duration of 6 to 8 hours should be practiced, but if we are giving, it should not be less than 1 hour. Hope it is clear. Now it can be discontinued when weight of the baby is around 2500 gram or reaches 40 weeks of post-conceptional age. In these 2 cases, we are discontinuing the KMC. Now bathing to the baby. Bath immediately after delivery should be avoided. In summer, preferably bath should be given to normal baby on second day after 24 hours. In winter, avoid for several days. Then any sick baby sick baby admitted to nursery with LBW, that is low birth weight, to not give birth until umbilical cord falls off or till the baby's weight reach to 2.5 kg. Okay, so these all are the important topic from pediatric nursing. Hope you have understood. Revise it well. See you in next video. Thank you so much.